The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
And welcome to Dr. Tom Roselle Live. We are live in studio today on this warm St. Patrick's afternoon, but slowly getting colder again because it's Northern Virginia and it's March and we don't know what to expect or observe out there. But as you can tell, Dr. Roselle is out of the studio again, and this is Dr. Stephanie Pina filling in for him to continue your quest on learning more about health and education. And the great thing is I never have to do this alone when I have to do it. I'm going to introduce my guest in just a second, but feel free if you'd like to call in, have any questions on natural health and healing, you can give us a call here at 888-630-9625. Again, that's 888-630-9625. My guest in studio today is going to be your lecturer on Wednesday night. That's going to be March the 20th. It's going quickly, from 7 to about 8:30. And he's going to be going over something that he went over last year twice. That's right. We had to repeat it twice last year. So it's a very interesting topic that I think from the Chinese medicine perspective, where we're both licensed acupuncturists, gets... You know, we can only say so much about it, and then we take it to another level. So in studio with me today is Dr. Qinglong Zhang, who's a doctor of chiropractic, a doctor of oriental medicine, and licensed practitioner.
Hi, Dr. Pina. Hi, everybody. I'm Dr. Zhang. We're glad to talk to you here again. So just like Dr. Pina said before, we did the 2-time lectures about these body signals and warning signs last year. And it was so popular, so we have to extend 2 times. So
we always want to make sure that everyone, if you didn't get a chance to go last year, you get to go this year, and maybe there's new signs and signals.
That's right. That's right. We're getting more information covered this year. So I want to talk about the why I chose this topic again. It's not only because it's so popular, yes or not, yes. So because I want the body, if you care of health, you have to know what happened at the beginning. You don't wait too late until you find out, is something there, but it's too late.
So the lecture is called Body Signals, Identifying Body Signals and Warning Signs. And at any point you are interested, you can always either give the office a call at 703-698-7117 to sign up and register your spot, since it's going to probably fill up quick. Or you can go online too at rosellecare.com and sign up and register there. If you're on the website, that's ROSELLECARE.com. You want to go scroll down and you'll see a thing that says Free Health Education Lecture Body Signals. Click on that and it will show you where you can register for free as well too. So that starts at 7 p.m. this Wednesday on March the 20th. Now you brought up something that's interesting, because the why, and why are we looking at things ahead of time, and I think what's interesting is that patients come in a lot, they expect either, here's our medical diagnosis that I've gotten, this must be all that's wrong with me, but really there's more things going on that we might be more observative. So as soon as they walk in, basically they're under observation.
Yeah, that's right. So why? Because from Chinese medicine, Chinese people is a very good observer. So Chinese medicine based on observation. So Chinese medicine have been there for over 3,000 or 4,000 years. So they think this is inside out. So they want to know the symptoms and then to detect what's going on with your body. So, for example, if you see your nail, if your nail has lune there, the lune is a white part of the nail. So it's the white part of the nail. If you do not see anything in the white part of the nail, which is not healthy, the healthy people are supposed to have a 5 to 8, the white part of the lune.
Out of the 10 fingers.
10 fingers. Yes. We didn't count the toes, the 10 fingers. So all these kind of symptoms can tell you what's going on with the body. And also from the other side, we can tell, so we want to throw the symptoms to find out what's the cause, what is underneath. The body is a very smart machine. The body very complex machine. Before the body getting any work, getting very severe disease, they already tell you something. They want to let you know, I'm in trouble now. Please pay attention to me. Focus on me. This is called the body signals and the warning signs.
And we see that all the time with patients coming in, because they may have gone to another practitioner, or they have lab work run, which obviously 3,000 to 5,000 years ago, we didn't have x-rays and lab reports and stuff to say, oh, your thyroid's doing great. Like, your kidney function is wonderful. So when we looked at that, I mean, that's really truly how all those observation signs really started to develop, is the fact that for so long, are you alive? Are you working well? Are you digesting well? Really was all that observational knowledge that was passed on from years and years.
That's right. So Western medicine went to China only about probably 40 or 50 years before we all use observation. You feel the pulse, see the face, see your tongue, see your ears, see your hair. For example, I have many, just like you said, a lot of people do a lot of lab work, and the lab work shows nothing, zero. Everything's negative. So, however, if a patient still complains something, that means the body is already compensating something already. So, if you don't know this kind of knowledge, you never know what's going on underneath. You wait until you go to many different doctors, many different practitioners. They don't know anything. They say, okay, your lab work is normal. However, it's not normal inside your body.
Right. The patient is able to recognize that I don't feel normal.
Yes, the patient.
And then this is where our observational skills really kick in, because we're starting to go, let's dive a little deeper and do things a little bit deeper. So that's really what your lecture on Wednesday is going to be focusing in on, is starting to get people to really pay attention to themselves.
Yeah. Just for example, I have a few patients, I feel very uncomfortable. What happened? So I went to urologist, went to whatever. So oncologist, even chest, prostate. I said, the discomfort is I went to bathroom not too many times. How many? 6 or 7. It's just too many. I said, okay. So next question is how much the amount? How much amount? No, it's not too much. It's just like I have to go. And I did a check. went to urologist, check my prostate. It's nothing wrong with my prostate. There's no BPH. BP is benign. Prostate hypertrophy, nothing there. And absolutely no cancer. PSA is wonderful. Kidney is wonderful. However, Dr. Pina, we know from Chinese medicine it's strongly to the liver and the bladder channel, the kidney and the bladder channel. If your kidney and the bladder qi means energy, means life force, is not strong enough, you cannot hold that. You have to pee all the time. It's about at night, because at night everything gets sleep, everything gets rest. Your organ functions are already low. If you have this problem, make it worse, then you can hold that.
So we know, like you were saying, like increased urination at night, not a good thing.
Not a good thing.
Not only that, is it going to affect your sleep patterns, because now you're not sleeping.
There we go.
And then you're not feeling so great, and your energy is low.
Yeah.
So next thing you know, what sounds like a urinary issue that someone would go to their doctor, like you said, a urologist, and have, especially in this case, I'm assuming a male.
Yeah, right.
Since they're looking at the prostate. They're having everything checked out the way Western medicine would kind of say, where's the functional piece that's not working right? Where's that physiological and the anatomical piece? When everything rules out, oh, you're fine.
Yeah.
But really there's other things going on that now can lead to additional healthcare issues, because you have no energy and not sleeping.
Yeah, that's right. So then when I treat the patient, use the different channel, use different, the technique from acupuncture, and also to try to boost the kidney function. And the patient said, okay, my gosh, I want to go in the bathroom at night on 2 times. So 2 times is still not perfect, but the guy is over 70 years or 60, 68, 69. So around this the age group. I said 2 times is very, very good for him. So compared to 6 or 7 times.
So the great thing in this case, it might be something that was going on for a long period of time, which, if you're looking at other kidney signs too, and we'll get into that just a little bit, just like you're going to do in your lecture, is that this might be also observational signs that if someone comes down with acute disease, like a cold or a flu, we might be able to see things really quickly that just happened. And sometimes we can catch that before they even start to get some of those signals. I mean, it's kind of still cold and flu season here.
Yeah.
In some ways, an allergy season is getting ready to start. But, we can use some of those same observational signs to say, the body's in this inflamed state. What's going on with it?
You have to treat it as soon as possible. Then, actually, we also acupuncturists here. So, the Chinese medicine designed not for treat a problem. It's designed for prevent. So in Chinese medicine, the best doctor is to prevent something. Just like I told you before, you have symptoms, something's happening there. Before you get the pathological change means you can tell from the images, from the lab work, it's already say it's not normal value, but it's called pathological change. Before you get there, you should catch that. You should catch it getting worse.
Yeah, exactly. So that's what your lecture, Body Signs and Signals, is going to be about this Wednesday. We know it's going to be a packed house, so you got to make sure and call in you can go old school and call into the office at 703-698-7117, or you can actually go online to the website, rosellecare.com, to register for your spot so we know exactly how many people are coming. And later on in the show, we're actually going to give Dr. Zhang's got some homework for everybody.
Yeah.
And whether you attend, hopefully you're going to be there, but if you don't, if anything, it makes you start thinking about your own health a little bit differently. I know when we talk about tongue and pulse diagnosis, or especially tongue diagnosis, after patients leave, what do? They run home and they start looking at their tongue in the mirror and they're like, oh my goodness, what is this? So you never know what you're going to get. So
that's right.
And any of that information is always great to tell your practitioner because you know yourself better than anybody else.
Yeah.
So that ingenious body is trying to do something.
Yeah, speaking of the tongue diagnosis, that's before I get in there, I just like last year, I told the patient, okay, a lot of patients brush the tongue in the morning. I said, okay, don't brush your tongue. I said, it's a candida, blah blah blah. If you candida, there is something wrong with your body. You have to treat the cause, right? And then some people, when I lecture, come back again, see me as my patient. I said, okay, you have something in your teeth. Did you brush your teeth? I said, I didn't. I said, why? You told me don't brush my teeth. I said, no, I told you don't brush your tongue instead of teeth. Right? Okay, that's joking.
So we also know, because of that, like, if we know with candida, we think of that as a yeast overgrowth, so there may be something on the digestive tract is doing well, and it's reflecting onto the tongue.
Yeah, if you brush your tongue all the time, then we lose the diagnosis too, especially for us. Yeah.
I always have those little kids that come in that get like a blue ice cream right before they come in, and we're going, well, that's just not normal.
No.
So
even though I tell my patient don't do the makeup when you see me.
So yeah, there's definitely years of observation that goes into this. So it's not just made out of nowhere. And even Western medicine has some of these same signs and signals that they start to follow.
Oh yeah.
But like we talked, and you've talked earlier about in other lectures about Frank sign, the creases in the ear.
Yeah.
We'll get back to the ear as we bring that back to the kidney.
Okay.
But we see that Western medicine is also kind of starting to pay attention to the fact that there's other things available.
As more and more medical doctor went to the holistic, their direction.
Right. Sometimes you'll see that as functional medicine, and a lot of times they're looking at lab reports again, so they're going back to what they know, but are they really truly looking at the person and trying to break down the person in front of them? So we're going to be back in just a couple of seconds. You keep listening here to Dr. Tom Roselle Live, and we're live in studio with Dr. Zhang talking about body signs. And welcome back to Dr. Tom Roselle Live. We are live in studio talking about body signals, body signs, and warning signs. And I am joined today by Dr. Qinglong. And it's been interesting because I think when we talk about, we so want to jump into like how exciting it is for the two of us as acupuncturists.
Yes, that's right.
To share that with the rest of the world, but the world should also know like we're used to we're trained to really look at someone from a different perspective.
Yes, we try to find out the cause, find out the root instead of just treat the symptoms.
Right. And so if we were talking basics, even before we get into the anatomy, body parts, like what do we see on the face and the eyes and here, such I know you go over in great detail at the lecture. I mean, even coloration is a really big thing. Can you go over some of the basic, what you might see with different colorations? Like, if someone comes in and say they have redness and where they're not supposed to, or I know we see a lot of this on the face in different areas as well too, because a lot of people, if they're going to look at anything, it's going to be usually their face in the morning. So it's a good place to start, right?
That's right. So for the face, when you see the face, there's a lot of things you want to focus on the color. For example, if you have different color in different area, also can tell different things too, because the Chinese medicine divide the face to different organ. So for example, if you have some dark color underneath your eye,
so underneath that lower eyelid.
Lower eyelid, yes, thank you. So lower eyelid, so that means your kidney is something wrong with the kidney.
And that brings up a good thing, because I know some of the people might be listening and stuff. When we talk about kidney, and we talked about this a little earlier, it doesn't necessarily have to be a pathological issue like I need to go to the kidney doctor. There's, in Chinese medicine, we look at it, those organ systems, like they have other functions as well too. So this might be related to like their sleep function and their urinary function as well. Yeah,
urinary function, yes. And also when I talk about kidney, be aware, kidney also, in Chinese medicine, we don't have any adrenal, the words in our books, in our education. However, the adrenal belongs to kidney.
So basically the kidneys are like the urinary system that we're used to in conventional medicine.
Yeah.
But then it also is covering our genetics, our DNA, what we pass on to the next generation.
There we go. Yeah. Yeah, the reproductive.
The reproductive system as well too. We talk about it.
Yeah.
And what's interesting is when we think about it, there's that HPA axis from the brain to the kidneys to the adrenals that we talk about in functional medicine. But really, it's that heart-brain-kidney connection as well in Chinese medicine. It's just different ways of looking at it.
Yeah, that's right. That's why I want to learn chiropractic. I'm also chiropractic too. I want to learn chiropractic to combine both of them, give the patient better analysis. So anyway, so the face, the normal color face should be a little ruddy through the shining. So, however, for example, if you have yellow color, the first thing is I only have one patient so far. The patient's face color is yellow. The palm color is yellow. I said, okay, I don't know what's yellow. I just went to many doctors to check it out. Nothing show up. Every year I do annual check, nothing show up. I said, my question is, do you eat a lot of carrot? She said, how do you know? Carrot is my snack. I eat it probably 3 or 4 times a day. It's a lot. So that means if a yellow color is not necessarily it's very pathological, sometimes because it's normal if you eat too much carrot. However, it can be worsened. It can be the liver issue, can be the gallbladder issue, and also can be the worm, the hookworm disease can show on the face of the yellow color too. Okay? How about another color is a dark color. Dark, sometimes we talk about the kidney around underneath the eye, you can tell it's a little dark black is kidney issue. However, sometimes because different people have different showing, different symptoms, some people can show underneath the eye, but some people can show the whole face. It's pretty dark. If you feel this patient, if you it's so dark, it's so no energy, so dark, it's not shining, it's also not a sign can tell you it's kidney deficiency too. When I see kidney deficiency, it's more from Chinese medicine, that means the kidney is not strong enough.
But sometimes, like when we think of like yellowness in the skin, or especially like the eyes, we know that the eyes connect to the liver. So there may actually be jaundice going on with actual pathological liver disease.
That's right.
Which you can see on a lab report, but it might be something we can catch ahead of time too.
Yeah, that's right.
So it's always interesting to kind of see, when patients come in and they say, everyone tells me I'm fine, but I just don't feel right. And this is a perfect example of why we need to kind of be a little bit more in charge of our own health and tell our practitioners what's going on as well too. Observational signs can also be different things that are going on. Like if you think about it, it's the 4 pillars of diagnosis, right?
Yeah.
So we have to listen to them. We have to hear them. Luckily, we don't have to taste them, but that's a good thing. But essentially, we listen to their stories and see what's going on, but then we're kind of always analyzing what's going on as well too in the background.
That's what we're here.
Body signs and how to identify them. That's going to be the lecture this weekend. We're going to be back in just just a couple minutes, but if you're interested in signing up for this lecture, which is going to be for one, you're going to have to give the office a call at 703-698-7117. Leave a message and say, I want to attend Dr. Zhang's lecture, and then we will get back to you. We'll be back in after this break.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to Tom Roselle Live. We are live in studio taking your calls, taking your questions, and talking about body signals, body signs and warning signs, and what does it mean when it comes down to observational skills, when practitioners really look beyond the numbers and the labs and the images to figure out what's going on with you and the cause of the problems, and possibly why you're not getting better as well too. Is there something that's not being addressed and identified? And this is kind of one of the key roots of diagnostics within the Chinese medicine system. So it's great to have, two acupuncturists basically breaking it down for you. But that's going to be the real topic of this Wednesday, the 20th lecture at the Roselle Center for Healing in Fairfax, Virginia. And you can sign up to attend. And then if you have your own questions too, then I'm sure Dr. Zhang is more than happy to answer them. And the way you sign up for this is you got to register your seat because it's going to be full. So one of the easy ways, if you're online, you can go to the website. Also, you're right there, you'll be able to see any of the upcoming lectures as well, too. But if you go to rosellecare.com, ROSELLECARE.com, if you scroll down where it has the free health educational lectures, you'll see a big sign that says body signals with the date on it. Click on that, and it's going to bring you to an Eventbrite page where essentially it will say free and you can register, because these are all free in-house lectures for you, and it's a chance for us to give back to the community and promote more education about health and healing. If you have a question for us here today, that you can also call in, and the number for that to reach us here at the studio is 888-630-9625. Again, that's 888-630-9625. Dr. Zhang.
Yes.
I have a question. Are you ready?
Yeah, I'm ready.
Okay, I think you're ready. I have a question where you have your training from China, and when you came over here and then got your chiropractic training as well too. When we talk about some of these observational signs, are there things that you've noticed that now that you're practicing here in the U.S. that are different than maybe some of the observation signs that you'd see with your patients when you were in China?
Oh, this is a very, very good question. This question addresses why I'm going to learn chiropractic. So I did notice many differences. For example, I have a patient have a stomach issue, GI tract, cannot digest very well, the GERD, doesn't feel well at all. So they went to medical doctor first, and then they check out everything. Then we think about something wrong there. I feel that we used to feel the pulse, see the tongue, see the face. I said, okay, so definitely can show some signs. The tongue is a little bit white, it's not good GI tract function. So because when I do the examination of patient, I try to combine the two ways from Chinese medicine way and a Western medicine way, because just like so I grew up in a medical doctor family. My father, my older brother, my sister-in-law, they're all medical doctors. So after they saw up a new patient at night, I thinking a lot, a long time. So I check here, and then when the second time patient come back, I said, let's check you. Do you have any spine discomfort? I said, no, I don't have anything, no accident, no trauma. Okay, let's check it out. So when the patient lie down, we check the spine. However, in some specific spine segmental, when I try to do a palpation, the patient scream. I said, just scream. I said, it's so painful there. So actually, that spine, everything innervated by nerve. That spinal nerve come out from the spine, goes all over your body to innervate your organ. That is the segmental, the spinal nerve come out from that segmental, goes to your stomach. So this definitely tell me something wrong with the nerve being pinched by spine, and then it cannot tell the stomach, okay, time to release the gastric acid, time to digest, or time to do your job. It loses that function. So then I try to because the patient already have a stomach function. In fact, you have to use the acupuncture to do something to boost the stomach GI tract energy field. Then you just from a structural standpoint to adjust their spine, the patient get a perfect result.
So one of the interesting things you just brought up really is when we figure out, when we're looking at, say, someone's whether digestive tract or their face like before, and we talk about the liver, clearly the liver is not on their face.
Yes.
If it is, we got another problem. But it's not there, but there are nervous system segments, nerves that go there that affect the activation.
Yeah.
Just like you mentioned, the lower back, the lower thoracic, if there's pain there, like it's going around and wrapping to and giving signals to the digestive tract that help.
Yeah.
So, and that's something that, chiropractors see all the time, but what's always interesting is there's a Chinese medicine, there's an acupuncture relationship to there. So it's always interesting to kind of combine the two.
That's why I love the clinic, because, same thing with you, we coach with some doctors, we coach with chiropractic, we coach with everybody here, even the nutrition is a triangle. This is our philosophy.
Right. So we're looking at that structural, body and biochemical, mental, emotional side too.
Yeah.
And we can see the mental, emotional side in people's observations as well too.
That's right. The liver is related to the anger, and if you same thing. If you have anger easily, you irritate easily, you get pissed off easily for even small stuff. Let me say your liver issue. Be careful your liver.
And we tend to talk a lot about here. I know Dr. Roselle loves talking about the lung and grief and sorrow that goes with it. You would think that's all we talk about. That and adrenals.
Right.
And, but the fact that if you have someone who, say, starts to develop a cough or a cold and it just doesn't linger, and then all of a sudden you get more information by them too. What else is going on? What's that trigger? It may have been a loss of a loved one. It may have been their digestive tract because of the connection between different organ systems.
That's right.
The lung and the large intestine.
Mm-hmm.
So it's interesting. So what we're really trying to say is that where your pain or where your issue is doesn't always have to show up where it is.
Yeah, sometimes it shows the difference. For example, you mentioned about the large intestine and the stomach channel. Channel means, the qi means the energy, the life force moving a specific way. So sometimes if you have a lung issue, or if you have a stomach issue, have the large intestine issue, they can show your teeth. Okay? So upper teeth relate from Chinese medicine related to your stomach, and the lower teeth related to your large intestine. Sometimes before getting any large intestine discomfort, it can show you the lower teeth get a problem or the pain, and you check with the dentist, and nothing wrong there. It's just pain without any reason. Then when you go, just like we do, when you go deeper, when you feel the pulse, when you see the tongue, something wrong with the large intestine. If you don't fix large intestine, you'll never get the teeth pain go away.
And if we think that just from a conventional standpoint, I mean, you're talking about stomach and large intestine relating to the teeth, and I mean, that's part of the digestive tract. It's just not the digestive part that's breaking food down. It's the beginning of the digestive tract.
Right. You talk about more from the West medicine to explain that.
Exactly.
That's right.
Exactly. So there's, even though some of these concepts from Chinese medicine seem either, vague or they seem unfamiliar, especially when we talk to medical doctors, we have to explain it, but some of it makes perfect sense. It's just a different way of explaining how the body's connected to each other, and that one thing flows into another. Yeah.
We have another example. So we all know from Western medicine, they already confirmed. So that means your GI tract and there is second brain. It's over 85% neurotransmitter made in the GI tract, serotonin, GI tract goes to your brain. Okay, so from Chinese medicine, if I have many people come here complain about, it's not complain about a GI tract issue, they complain about, I'm dizzy, I forgot something easily, I cannot sleep very well, a little bit headache in the morning, this kind of brain fog issue. So when we go deeper, you can tell they don't have enough GI tract support, they cannot digest food very well, they cannot get the nutrition what they're supposed to get, because Chinese medicine think the kidney is a genetic foundation and spleen and stomach is a acquired foundation. So you have to, kidney is the source of energy, is the whole body source of energy, no doubt. If you don't have enough kidney energy, your kidney energy cannot go to your brain to tonify your brain, make your brain function very well. However, kidney always do some work. Who support kidney? It's spleen and stomach, right? And spleen and stomach, if they digest very well and support the kidney, then brain function well. It's all lobe, this circle.
Yeah, so like you're saying is that kidney energy is kind of our base energy.
Yeah.
And then our acquired energy, which is in the spleen and the stomach, can be like how we acquire it from food.
Yeah.
The foods we bring in, the nutrition we bring in, what we eat. So again, going back to what we eat and we put in our body affecting our overall energy.
Yeah.
If we eat bad, no energy.
Yeah.
If we eat good and we got the nutrients, energy.
Speak of food, actually, I have a patient asking me the best question so far. So the patient asked me, the patient had the stomach surgery, since they said, okay, Dr. Zhang, so you always talk about the qi level, the energy level, the stomach, the life force level. My stomach is, where does the qi come from? The qi is the air, or the qi is the oxygen, or what? So actually, when we talk about the qi, the energy level, it is two parts. It's food qi and air mixed together. Right? And then we can match why nutrition is so important. If you breathe very well, it's very high intensity, not so high intensity also is not good. So if you don't have any very good stomach function, if you cannot get a very good food in, you still don't have any energy. So as I tell a patient, okay, I do acupuncture on you, I improve your GI tract function, I improve your stomach function. However, you have to make sure you eat properly. You eat right.
Right. There, I mean, I always remember that there was, in a lot of the Chinese medicine books that we had the basics in school, right? The basics. For us, we're like, oh my goodness. But, you know, they used to have that picture. They had like a campfire, right? And they have a pot on top of the campfire, and then they have the steam coming out. So it's very easy to kind of imagine this little basic picture. But that kidney energy is basically that fire to get everything, it raises up, it wants to warm up the body and allow it to function. That pot becomes like your digestive tract, that it's absorbing and it's breaking things down, and you're trying to assimilate everything. And then what's being released, that steam, that's kind of like the air and stuff that we're also bringing in. We need that as well too.
Yeah, that's right.
So there's some very basic stuff in there, but it's like if you go back to 1, 2, 3, right there, you know where you start treating. So it's not always about treating where there's a problem. It might be treating the source to make sure that the body's strong enough to actually do that type of treatment.
Yeah, this also, we talk about many times, is what we are here. And also, I believe this is the direction where medical treatment should go. You're not supposed to only focus on one part. You're supposed to focus on the whole body. The holistic is more and more important. The good thing is more and more people, more and more doctors really notice that. And I have some patients tell me, okay, this dentist is holistic, this dentist is not, whatever it says. But good thing is more and more people notice that, which is a good sign.
And the more people, either come to lectures like this or they read up on it, they're getting information that really makes them pay more attention to their own health and become more of an active and component in it as well too, instead of just being told, well, I'm going to take this medication and it's going to make everything go away.
Yeah.
Well, what is that going to lead you? What's the side effects of that medication? What's that going to do? It's got the same kind of holistic effect. It's just in a negative way.
Yeah, it's horrible. Same thing. I grew up in a medical doctor family. I never say do not go any medical doctor. You should go if you really need to go. So I tell my patient, when I was doctor in China, oriental medicine doctor in China. I also teach some students. I tell my students, okay, so your major, your profession is oriental medicine, but however, if I get a fracture on the road, don't bring me go to fracture. It's very bad bleeding. Don't bring me to the oriental medicine doctor. Go to the ER right away.
Right.
Yeah.
And then bring them to the medical.
That's one. Yeah, that's right. Thank you. So then after that, then we should take care of left. Yeah.
And this is where it's interesting, because in that type of situation, right, if someone gets a cast, so we can't necessarily needle on that arm because there's a cast on it. So what are we looking at? We might treat another part of the body because it reflects onto where that break is.
The break is a fracture, same thing in Chinese medicine, the kidney and inside the bone. If a kidney is pretty strong, your bone marrow is pretty strong. We can tonify the kidney. We don't have to put the needles on the painful part, If you see some acupuncture, I know. So if you see some people pain here and some acupuncturists just put the needles here, I don't know
surrounding that area where the pain is.
Yeah. So
Yeah. So I always think it's funny. One of the funniest observation signs that I had on me when I was in school is we were doing ear diagnosis.
Oh, yeah.
And they were going around and looking for the lines, looking for the colorations, and you'll get much more information at the lecture as well too. So the doctor stopped at me and said, "Everybody come over." And I was like, "Oh my goodness, what's going on with my ear? Like, this is not a good sign." So she comes over and says, "I want you to look at this line." And I was like, "Oh, what's wrong with this line?" So I was like, "Do I have that cardiovascular line?" Like, so she pointed out that this line was a missing tooth line. And so it's also in the kidney part of the body because it refers to the joints. And what was interesting is as a child, I had orthodontic work done. So they had pulled teeth out. They don't do it as much. And so basically because it had been so many years, I actually had that line there. So it's still there at this point.
That's interesting.
I get to use it when I do observation skills. Like, look at my hair. Do you have this? So, but it definitely brings us to some good questions that it can be stuff that's with us for a long time or something acute too.
Yeah.
So when we come back, we're going to give you Dr. Zhang's top 10 questions, homework questions. You get to go home with and bring those answers to the lecture on Wednesday the 20th at the Roselle Center for Healing. Go online or give us a call to sign up. You want to make sure you reserve your spot. Coming up in the next section, we're going to do the 10 questions, so you get your pad and paper during the break, and we're going to go from there. We'll be back. This is Dr. Tom Roselle Live.
105.9 FM and AM 630 WMAL.
And welcome back to Dr. Tom Roselle Live. We are live in studio, and we are talking about body signals and signs, warning signs that you and your practitioner should be looking into to see if your health is going in the right direction. And all this is leading up to Wednesday, March 20th lecture at the Roselle Center for Healing with Dr. Qinglong Zhang. And he is going to now give you, or I'm going to give you for him, his homework.
Yes.
He's putting you guys to work. So I hope you grabbed your pen and paper. And we might be able to somehow figure out how to make this available online too. If you want to give us a call, if you miss anything, just email or call into the office and we'll make sure that it's the front desk also has a copy of this too on Monday, and so we can always get it back to you. But here are your questions to have. Now, how many lun do you have on your 10 fingers? So we talked about this earlier. This was the little white kind of spot. The little lun is like a moon, so this should be a little moon on the bottom of your fingertips at the base. Do you have them on all your fingers? Are they there to begin with? What color is your tongue? Now, yes, and not everybody likes to stick their tongue out, but if you do it yourself the first time, it's okay.
Out.
Exactly. So do it before we see it. Is it red? Is it pale? Is it white? What does it look like? Does it have that coating that, everyone wants to brush off and stuff too? So what color is your tongue? What does it look like? Do you feel tired when you wake up in the morning? And I would say with that too, like when does the energy come in the afternoon if it's kind of that? Yeah. So what time are you still feeling tired in the morning? So are you not getting enough good sleep and stuff? So you're just not feeling like you're waking up. How many times that night do you go to the bathroom? Are you waking once, twice, multiple times? How long has this been going on for too? Like, is this a new thing or an old thing? If you have a headache, this is question 5. Do you have a headache and where is it? So is it on the front of the head, over the sinuses? Is it the back of the neck? Is it on the sides? What does it feel like as well too? Like that tells us a lot about what's going on and diagnosing your headache as well. Do you have any eyebrow loss? So this could be in the center, this could be on the ends, the lateral third in particular. Yep. So we know where this is going. Is there hair loss there? And sometimes also hair loss that should not abnormally be anywhere else in the body, but especially on the eyebrows, looking at the face. Mm-hmm. Do you have any ringing in your ears? So the medical diagnosis for this would be tinnitus, but do you have any of that high-pitched or low-pitched kind of ringing that kind of is constantly there? Mm-hmm. A lot of people will end up saying, oh, well, during the day it's not there, and it's because really we're more active and there's more sound, so all of a sudden it comes back at night. Well, it's a lot quieter, hopefully.
Yeah, sometimes the ring in the air doesn't mean you have air problem, right? Yeah,
exactly.
We'll tell you more. Yeah.
That's the part you have to wait for, right?
Yeah.
Do you have white spots on your fingers? So are you talking about the nail parts?
The nail part, yeah.
Yes, exactly. Mm-hmm. So do the nails have any discolorations, whether they're white or brown or lines? Mm-hmm. It says a lot about the way that the fingertips and how it relates to the liver,
yeah.
And the rest of the body. Mm-hmm. I like the fact that a lot of this has to do with the face. So again, once you just get in front of the mirror, you got all this done.
Yes.
It makes it easy. What is the color of your nose? Do you see discolorations? Is it red? Is it not red? Is it, what's going on with the nose? What coloration is it? And the final question is, do you have any spinal discomfort? So we had talked a little bit about how a spinal segment can lead to other issues too, maybe tender. It doesn't have to have a disc issue or a back issue, but it's leading to something else. Even more so, I would say, if there isn't any history of back issues and all of a sudden we find something that's not supposed to be there.
Yeah, that's right. We talk about the patient, the body always compensates to you before getting anything worse. Yeah, this coming Wednesday, I will tell you if you really concern your health before getting worse and you don't want to get suffering from the disease, you have to come here to listen to me. So how to know what's going on with your body, and also Dr. Roselle always asking me a question, can you fix that? My answer is always the same. That's why we are here.
So make sure you call the office to sign up, 703-698-7117, or online, rosellecare.com. Click registration, and we will get you registered for a spot. The girls in the front will basically give you a call to confirm, and if you don't hear from them, give us a call back. We'll try to post these numbers.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.